Neuroprotection by progesterone. Traumatic brain injuries often result in significant neurological damage. Importantly, the extent of the neurological damage can increase in the hours and days after the incident, and brain cells are often slow to heal. This can be a dangerous time for patients that are recovering from severe injury. Recent studies have indicated that the administration of progesterone in the hours after brain trauma can reduce the tissue damage and promote cell recovery. This hormone can be injected directly into the bloodstream. When the progesterone molecules reach the brain, they'll enter the injured tissues together with blood that is leaking from damaged vessels. Having been delivered to the site of the injury, the hormone has multiple beneficial effects. Some of the progesterone molecules stimulate the endothelial cells lining the blood vessel walls. This action restores the tight junctions between the cells, thereby restoring the blood-brain barrier. The progesterone molecules that have leaked into the brain tissue have additional targets. One of these is the oligodendrocyte cells that produce protective myelin sheaths around the neuronal axons. These cells have been stressed by ischemia and reperfusion, and progesterone has a protective effect that blocks further damage. Progesterone also affects the behavior of neuronal cells near the site of injury. The flood of glutamate signaling at synapses is reduced, which limits the amount of calcium inflow through glutamate receptors. As excessive calcium inflow is known to have cytotoxic effects, neuronal cells that have been exposed to progesterone are protected. One of the major contributing factors to cell stress and damaged brain tissue is the inflammatory response that is brought on by cells of the immune system. Activated immune cells are also receptive to the progesterone signal. In this way, progesterone therapy also helps reduce harmful inflammation. At the site of injury, the inflammatory response is induced when immune cells of the blood, such as these macrophages, are activated in the environment of the damaged blood vessel. Other cells of the brain, such as these microglia, can also sense the damage. Together with these macrophages, these activated cells release cytokines that initiate the inflammatory response and act as an attractant for yet more immune cells. When progesterone is present, the hormone enters the cell and acts as a switch that shuts off the production of inflammatory molecules. Lowered cytokine levels limit stress on the surrounding tissue and reduce the attractive signal that would bring additional immune cells to the site of injury. As progesterone reduces inflammation, it is also stimulating the repair of blood vessels and the activity of oligodendrocytes in restoring damaged myelin sheaths around neuronal axons. This simultaneous combination of neuroprotective effects explains why progesterone therapy is an effective treatment for traumatic brain injury. Until recently, severe brain injuries have frequently been accompanied by reperfusion stresses and a strong immune inflammatory response. These physiological reactions result in a cascade of negative physiological effects that cause further brain damage. With progesterone therapy, this secondary damage can be reduced, enabling a faster recovery with better preservation of brain function.